Good.
Man.
There we go.
Oh, much better. Looser.
Awesome. Hey guys, Dr. Eric Smith. Today I'm excited to be treating this ex-military. You were in the Marines, right?
Yes.
Awesome. He was in the military, so the Marines for 4 years. This is Jesse. So Jesse is here in Chicago with me, and he's been having some lower back pain. Obviously, all those years of serving our country and doing the great things that he has done has put a lot of pressure on with all the extra gear, putting pressure down there. And so originally he came in with some lower back pain that kind of radiated down. And then he also studies and participates in Muay Thai, right?
Yes.
Awesome. So he's been doing a lot of kicking. And so how have you been since treatment started?
I've been a lot better, especially my lower back. I feel a lot better. The pressure's been relieved. So whenever I do any kind of bending from the waist, things like that, it feels a lot better. Versus before, I can bend right here, I started having trouble, but now I can go all the way down. So I definitely feel that, and yeah, everything starts to loosen up, moves better.
Yeah, so in his treatment plan, one thing we've been doing is a spinal decompression. So with all the compression over the years, with him being so muscular and such, and so compact and tight, that it's been pressing a lot in his low back, and now he can actually move and get better range of motion because his joints actually work as individual pieces instead of just one clumped up thing. So he's also having some pain in his upper back, so we're going to do a full spine adjustment today, and I'm also going to take a look at his right knee. From all those kicks, he kind of twisted a little bit, and then hopping up on boxes and doing all the stuff that he does when he's in training. So what I'm doing now is just checking out a few things, seeing where he's a little locked up, things might not be moving as well. It's also kind of palpating to see if there's joints and muscles that are kind of sticking out to me that might not be in the right position of where they should be, and also extra tightness. So he's very, very tight up here. He's built very wide, and a lot of times you'll see that too if you're one of those people that was maybe a gymnast or a swimmer or just built kind of wide through the chest. You might notice that you get a lot of extra pain or restriction and tightness in there, and especially with people working at home a lot more, being at a desk, that can happen too. So it's not just for people that don't work out or that do work out, I should say. Anybody can get it, and sometimes it's just the structure, how you're built. So we'll be working on that today. And he's already gone through his decompression session today. If you feel like you have lower back issues and or pain shooting down your legs, some sciatica or degenerative disc disease, decompression is something you should definitely take a look at. So definitely got to do some work in here. Awesome. Okay, let's start with an adjustment right through here. Nice deep breath for me, please. All the way out. Good. Let that drop. Awesome. Good. Let's have you lay on your right side for me, please. So he's like me, where he's going to adjust a lot better laying on his back for that mid-thoracic area. So that's why I didn't do some other adjustments I typically do. But so we'll get to that in a minute. Right now I'm going to adjust the sacroiliac joint. The way I'm going to do that is just bring his leg up. Let this relax for me. Good. Let's go to the other side. Caught you off guard with that one. All right. And now this one, we're going to let this relax. Let that hamstring relax for me. Just drop this leg. A little bit different adjustment for what you have going on. Maybe right on your ischial tuberosity. Oh, brought that up a little bit. Excellent. How'd that feel?
Really good.
A lot of tightness through this lower part of the neck and into your thoracics. Right in there. So let the shoulder relax as much as you can for me. Good. A little bit more. There we go. Good work.
Yeah.
So sometimes when you see that, when chiropractors do that, when I went for and adjusted some of that, I felt that the rest of the joints kind of around my hand didn't really move the way we wanted. So now when I moved his head, we kind of got restricted about this point, but now I can take his head and almost put his ear to his shoulder. So a lot less restricted in terms of that. And because I'm moving his head, he's not using his muscles, so it tells me that's a joint restriction. Versus if I had him do that, just move his head with his muscles, you can't really tell if it's just the joint or there's a muscular tightness that's causing that lack of movement, because he's relaxed and he's been adjusted a few times. He did very good allowing me to get those motion joints that needed adjusted. So we're going to go right at the top here. Great. A lot of movement today. Have you ever competed with your martial arts?
Yes, once upon a time, long time ago.
Yeah,
But
no more, right?
No more.
Just training and only using it if you have to.
Yes.
Awesome. Tuck your chin to your chest for me, please.
Good.
And this one, I want to get your TL junction a little bit differently. So what I'm going to have you do is give yourself a nice big hug like you are. Yep, good. Sit up for me, and then nice deep breath. And let it all the way out. And let me have everything here. Perfect. Good job. Yeah, that's with you. And sometimes what I find with patients is that they're stuck in this position, and this is the easier thing where they feel like some pain, but they feel better going like this. And I want to actually adjust you in the right position that makes your body feel better. Your body's pretty smart. So if you move a certain way, it makes it feel better, and you don't have to work too hard to get there. That might be an indication of a way that we need to adjust. So that's a little bit different adjustment than you've seen on some other patients I've done, but that's why exactly I put him on his back. And when we had him face down, he just didn't adjust the way that I want. So one thing we're going to do with his knee is over his life with the things we talked about earlier, he's probably had a lot of compression in his knee and his meniscus. So I like to do a little distraction technique just to get some more movement and get some pressure off here. So it kind of resets the meniscus a little bit on there. Make sure while you're tractioning the leg, and usually a lot of patients feel better. So usually knee problems come from the inability to actually fully extend the leg. So you'll probably notice some older people or things like that you have a hard time actually flattening the leg out. So what I'm doing is just helping and assisting that knee to get in that position, okay? Let this relax so we can adjust your hip.
Oh,
good.
Man.
Yeah, this one feels better. Good. Get your ankles while we're here. That relax. A little restricted in this position. Good. People love that one. They always crack up because you're stretching everything, and they can feel it usually all the way up, and it's hard for you to do anything with your ankles.
Good. Yeah, I'm just like, wow. Oh, ankles.
Awesome. Okay, let's have you sit up for me, please.
All right.
Yeah. And then while you're here, let's go ahead and move your head in a nice big circle. See how that feels in that lower area.
Oh, much better. Looser.
Awesome. Go ahead and stand up for me, please, and try to bend over and touch your toes again. Oh, yeah.
Yeah, definitely.
Awesome. So, range of motion, muscles relax. Overall, just better posture. And as he's already doing, he's twisting, because
Yes,
that's what we
every
want
time.
to see, is to make sure. So, if you have some of these restrictions and you want to get better a little bit quicker, I highly suggest you talk to a chiropractor. And then I look forward to seeing you continue to grow. This man's looks like been putting on some muscle and leaning out at the same time since we've been adjusting him. So look forward to your progress. And like I said, if you have any questions, comment below, and we'd love to help you. Thanks a lot.